for older persons in the Parliament of Uganda. Thank you so much, Peggy, for joining us.
Thank you. I'm happy to be here.
And also with us is Prosper Bonebye. He's the Commissioner, Disability and Older Persons Affairs of the Ministry of Gender, Labour and Social Development. Good morning to you, Prosper, and thank you for joining us.
Thank you, and good morning, viewers.
Also with us is Miss Alana Kembabazi. She is the Programs Manager, Initiative for Social and Economic Rights, ISA. Thank you, Alana, for joining us. It's always a pleasure to have you.
Good morning.
And last but not least, we do have John Orach, the member, National Council for Older Persons, also going to shed light on this conversation, and of course speaking from the older person's perspective, sharing different experiences since he works closely with them. Good morning to you, John, and thank you for joining us.
Good morning, Israel. Good morning, viewers.
And yes, and that is the full panel that we have on set, and they will be helping us to unpack these issues and as well shed light on the potential solutions. And now, as we get to kickstart this conversation, I would like to start with you, Mr. Prosper Bonebye, from the Ministry of Gender. Of course, would like you to help us briefly talk about the current social protection programs that are available for older persons in Uganda, and also highlight for us what the government is doing to ensure the effective implementation of these social protection programs.
Thank you, Mildred. Social protection start with, these are private and public interventions to mitigate shock. So older persons or any other person, you're at this point when you are likely to drift into shock, to drift into extreme vulnerability, and social protection comes in to really mitigate that, to leave you at a step where you can survive, you have survival mechanisms. So what has government done as far as older persons mitigation shock is concerned? 80 years and above, we have senior citizens grant, what most Ugandans call SAGE. Then below 80 years to come down to 60, we have what we call the Special Enterprise Grant for older persons. And these are what we call core social protection programs. Then we have complementary social protection programs, and this is where we have parish development model. It's a soft loan based program where you pick it, use it, and then pay back. So it enables older persons access funding, but we don't categorize it as a social protection program because it's a loan. However, it's a complementary social protection because it helps someone to mitigate the shock. If someone has his plantation of coffee and he has his casual laborers to work in and then boost the production and get some money in, it becomes a complementary social protection program. Of course, older persons are not discriminated from all other government programs in the country. Under agriculture, we have a very robust pension system in the country. 10 years ago, we used to have a lot of problems with many of our dear older persons lining up in Wandege at Public Service, Minister of Public Service, trying to get their pensions. But we have, under social protection programming, we have since decentralized the mechanism that all older persons can go to their respective local governments and pick up the resources. The other area that is in the pipeline and very critical for older persons is the health insurance. The funding, the 25,000 that older persons pick under the senior citizens grant, 50% of it is spent on health. And we think when government in the next financial year picks up the issue of health insurance and our older persons are able to get free, adequate and quality health care, we would be ahead in as far as social protection is concerned.
Okay.
Yeah.
Well, thank you, Prosper. On to the Honorable Peggy Wako. You have heard from the Ministry of Gender, and I would like to hear from your perspective in Parliament. Do you feel that the government's efforts are adequately addressing the needs for the older persons? He has clearly stipulated some of the programs that are available.
Thank you, moderator. I think government is trying, but you see, the resource envelope is not enough to cover everything. He has talked of SAGE program. SAGE, as you know, they get 25,000. Some people say this is too little, but there are some who are very grateful. When they receive this money, they have really utilized it, and we have seen this when we go down on oversight in the field there. You see them, and the program for old persons has now been known because of the SEG program. At least SEG now is known everywhere. But there are some problems, as you have said, because the cost of living is going up. The 25,000 is what they have been getting since the program started. It's not enough. Some of them feel it's not enough. You know, the old people with sicknesses, many of them fall sick, and when they go to hospitals, they are charged highly. The money they get is not enough to cover their hospital bills. That's why the commissioner said that we are planning to have health insurance for the persons. For sure, this is in pipeline. We had thought in Parliament that it would be, we tried to convince Parliament that it is through this financial year, but it was not possible. But it's in the pipeline. We hope in the next financial year, our old persons will be able to access the health insurance.
Okay.
And that is not all. Formerly, it was difficult for them to get the drugs for these old persons. But when we went to Parliament and the Council for Old Persons, we really fought for these drugs at least to reach the health center for us. As I talk now, at least in every health center 4, health center 3, you'll find there drugs for old persons, which was not the case before. So at least that one is the beginning. And if we can succeed in getting the health insurance, I'm sure the old people will be very happy.
Okay, as you wait for the health insurance, has the access to the other social protection programs been effective for the older persons, in your view?
In my view, I think they have been effective. As the commissioner said, apart from this SEG program, because SEG caters for those 80 plus, we have this other group from 60 to 79. So through Parliament, we advocated for another program, which the commissioner talked about, called SEGO. We were given a grant. This one is given to this age group of 60 to 79, because we feel if these people are given something, they can utilize it for their welfare. They can do some business. He can buy a goat, he can buy a sheep, he can buy a pig, and when it produces, he sells those. So that's why we give them much more. At least we tell our old people to organize themselves in groups of 5 to 10, and each group is usually, those organized groups, they are given up to 5 million. And when they get 5 million in a group, the security are those your fellow members within that group. If you don't pay, your fellow members are on you. And when you get it this time, you utilize it, they will be supervising. Did you drink it? What did you do with that 1 million? So I think government is trying.
Okay.
Not only that, we thought that one was not enough. When the government introduced the parish development model, in the first arrangement, the old people were not thought of. But we fought hard through Parliament to make sure that our old people are also catered for. First of all, they were not put on the parish committee. They had said that it should be an opinion leader with us. We said no, it must be one of our members. These old people should be a member on that parish committee. And when they are there as members, when the funds come for the parish, that 100 million, when it comes, it is a rule by the government. It is a policy that the old persons must get 10%. And 10% of 100 million is 10 million. So at least every financial year, in each parish, if they can get 10 million, in every parish 10 million, 10 million, really if they use this well, I'm sure all the people wouldn't be complaining anymore.
Okay, I'd like to bring in civil society, that is Ms. Alana Kembabazi, to just highlight the role, because this conversation is a multi-sectoral conversation, and as the civil society, you have a role that you play in advocating for the rights of the older persons. And so I would like you to highlight that for us, and also in there you can also highlight some of the biggest barriers for the older persons when it comes to accessing some of these social protection programs.
I hope I can be heard clearly. I wasn't sure about the mic, but I do want to underscore that social protection is supposed to be a cushion. And for older persons, many of whom are facing disability, it is extremely important that they are able to get this support. Countries everywhere, even America, which has issues, when it comes to older persons, it's uncontested. They have spent their lifetime serving the country in different capacities, whether it is just growing crops, because we need food, or whatever it is they've been doing, and there are times in life when they are vulnerable. And I think it's a good reason why we recognize that from 60 onwards, because the reality is your energy is low. So the idea that you start a social enterprise at that time and it will keep you, maybe to keep you busy, but the idea that it's supposed to be a profitable venture, there'll be a few stories here and there, but the reality is that for many people, and we've experienced it in our own families, my own father had stamina to take buses, the village, do what, all that stuff gradually went away, and disability often accompanies it. So it's extremely important that social protection is holistically thought of, I think, by fellow panelists who've noted the issues around healthcare and geriatric healthcare, around the cash transfers, and those are very important to enable someone to have their basic needs. Basically, these are rights. Today is Human Rights Day. I want to underscore social protection is a right. It's not a favor. And when you look at it as a right, that means the conversation begins to change in terms of what government must do. When there are rights, you have an obligation to devote maximum available resources. In other words, look everywhere, have you curbed any car leakage? Is there something hiding in the corner that you can put in there to make sure you dedicate maximum available resources? When you give SAGE the same amount for 10 years and it stagnates, when we know that the cost of living is going up every year, there is a problem there. And to make matters worse, we know that now there's been a cut. Many of you are not aware. They read the budget and gave very nice figures, but there was a 17% cut. And that means that 30,000 beneficiaries plus in the current program will not get SAGE money. It also means that anyone who turns 80 this year, sorry for you. And we are looking now in the budget process for the next year. And that is likely to happen unless urgent measures are taken. And I must underscore that every Ugandan must be interested in this conversation, because you're going to get old. You are going to see the earnings you have reduce. You are going to see how inflation eats into your savings. You are going to see how the healthcare system defeats you. And because you are paying taxes in some form through your lifetime, I like saying every bit you pay is taxed in different ways. It's really important that the state upholds the social contract, because we have a social contract with the state. We pay taxes, we give up some freedoms with the idea that when life happens, when there are certain hard events that happen, there must be a cushion. I think it's unacceptable for older persons to have to live in absolute dire poverty. I commend the government for what they are doing, and the department here, particularly Ministry of Gender, for really spotlighting and trying to reach them. But we must do more. We must determine as a country that we can and must do more. We have loads of natural resources.
Okay, so then how is the civil society collaborating with the government to ensure that some of these gaps are addressed? I'll also a bit later after you've submitted, hear their response in regards to some of the issues that you're raising.
I would say that as civil society, we've tried to share best practices. You know, we released a report together with the Ministry of Gender and with RAISE on the African Union Protocol on the right social protection. At the Africa level, this issue came up very strongly, particularly with COVID. And we assessed how, you know, Uganda's social protection system in light of the protocol, which is sort of a best practice. We saw Uganda in some ways is doing really well, but there's significant gaps. Some of the ones are pointed around. Around safeguarding it as a right and also around financing. Okay. We also do a lot of budget advocacy. You know, I think as government, there are different parts to government. So I think it's very important in our part, because we work with different government actors, we try to really push for certain issues through a whole of government approach. It requires a lot of political will. That's how programs like SAGE came, you know. There was political will in the first place, and I want to commend government because they transitioned from donor support to government support of programs like SAGE, which shows a commitment to older persons. Okay. But we need that to happen more, and as civil society, we continue to do that. We also are having a conference. This is my plug for you all to please come for the public conference tomorrow, Wednesday. It's an opportunity to discuss these issues. We have a wonderful keynote. Professor Suruma, the Ministry of Gender, is leading on very interesting discussions. We have Ministry of Justice as well, and we're doing this in partnership with the Ministry of Gender. And the Expanding Social Protection Program. I think it's extremely important that the public comes and is part of these discussions to appreciate what is being done, because so much is being done. Okay. And some of you may not even know about it, but also to be able to put our heads together and say, okay, what can we do to improve the lives of older persons? Okay,
and still staying with you, Alana, before John comes in, still ahead of the conference, there is an advocacy that you're doing around people's pension and, of course, pushing for the social protection of all older persons as a right. Tell us more about it.
Yes, I think it comes from the fundamental idea that social protection is a right. And when it's a right, it means you budget for it, you plan for it, you check up on it. And we've seen that in this country, pensioners, for example, they must be budgeted for. It's in the law. Programs like SAGE are wonderful, but they're not yet enshrined in the law. They're in a policy, and government has put a lot of effort into it. It's important that this is also enshrined in the law for sustainability, for future generations. You can do something fantastic, someone else comes on, and maybe that's what they prioritize, and they move. But then what happens to this group of people? So a huge part of that campaign is to say that every older person must be able to have some sort of social protection and some sort of pension, right? Recognizing that, yes, people should work, they should save, they should invest, but there should also be a cushion provided when life happens uncontrollably.
Okay. Thank you, Alana. And to John, a member of the National Council for Older Persons, you're the person that is, directly working with these people. Would like you to highlight what are some of the key issues that the older persons have raised in regards to social protection.
Thank you, Mildred. Let me assume the role of an older person, because I'm an older person.
Yes.
So as they say, it's the
yes.
the wearer who knows
the shoe. Okay.
Yeah. So I am in that category of older person.
Okay.
Allow me to speak from that angle to start with.
Please.
One, like Anana plainly put it, she quoted who is an older person, 60 years and above. That is recognized by the UN, the Uganda government, and even the African protocol, which she referred to. Now, when we are talking of, you see, this SAGE program started in 2011, the first payments. Okay. 2011. By then, the amount was 20,000. And it started in 14 pilot districts. Yeah, and then it was 20,000. Then it kept on going by 1,000. Yeah, until it got to 25, then it stagnated. That's the issue the Honorable was raising. Yeah. Since then, it has remained at 25. Right. So after the pilot phase in the 14 districts, another district was added on and they became 15. The program was very successful. So civil society, by then we didn't have a council yet, civil society started pressing, and the older persons themselves started pressing for a rollout. Let's roll out this program to all the entire country. Now put myself as an older person. I am in this district, it is not getting SAGE. But the next district is getting. Now how do I feel? Those people are just as old as I am. We are the same age. The pilot has proved that it is workable. It is very, very useful. The advantages were obvious. But since that time, there are districts who went on for 8, 10 years, just seeing their neighbors getting. And we thought that, unfortunately, was discriminatory for a program which was meant to benefit all the persons.
Okay.
So it reached the extent that I think it was the 2021 elections. It became an issue, an electoral issue. And the parliamentarians started getting worried that if this SAGE did not reach their constituencies, their chances of coming back as parliamentarians were very threatened. So they connived among themselves in parliament and put the age at 80. Now, let's make it. My commissioner is see, that 80 is arbitrary. There is no law about it. Yeah? There was no discussion apart from the parliamentarians who decided because of the available money, we cannot afford to pay everybody everywhere. So let's put the age at 80, which is a bit manageable, because 80 and above, they are only about less than 300,000 older persons.
Yes, because I was going to ask, what is the life expectancy and how many actually get to that age of 80?
It is very difficult. In some communities, you don't find anybody who is 80. Yeah? Okay. But in other communities, like where I come from in Yumbe, I don't know why we sort of live longer. There are several people. Yeah, there are several people who are 80 and above, which is true. Okay. But that 80 was arbitrary. And then Parliament decided, when they fixed that age, that every year they would be reducing by 5 years. So it should have now come to actually 60. But we are still at 80. She wasn't there yet, because by then...
21 was there.
You got later.
I would want her to directly actually respond to your claims, but after your submission.
Yes. For us older persons, this SAGE is a lifeline. Regardless, you disregard whatever somebody says the amount is small or what, half a loaf is better than no loaf. Huh? And we are very happy for that amount. The older persons are very happy. They appreciate it has done wonders for them. It is a lifeline. But it is limiting. You see, this SEGOP, which came up 2 years ago, is filling a gap where some people had been missing SAGE, which is their entitlement. It's a right. Because, like we say, social protection is a contract between the government and its citizens. Okay. The government is obliged to provide that social protection. Okay. In fact, the African Union Protocol says it. I'll read it later on. So it's a right to which every older person is entitled. I'm going to ask my colleague here, when she goes back to Parliament, that's the next thing we want to hear. The age is come down to 60, not even 65, because it is defined clearly an older person is 60 and above.
Okay. And I'll let her to actually respond to, you've heard John Oraj. He says that the Parliament connived to keep the age at 80, and also the promises that you made that it will be reduced, you know, by after 5 years, you said?
Yes.
And up until now, it is still...
every year.
Every year.
By 5
years.
Yes.
Up until now, we are still at 80. What is Parliament doing? Is it true what he's saying?
Actually, what John has said is the truth. But then, we had some problems. We as parliamentarians, You remember when we came in 2021, there was this issue of COVID. And most of the donors had withdrawn their funding. You see, when this program was starting, we had donors. Now when the donors withdrew, the government had to say, now what do we do? They had to look around. Through their taxes they are receiving, they said, no, we must maintain this program. Then civil society and we as politicians, we came in. We said, you are segregating. Why are you serving few districts? We insisted that this program must be rolled out. It went on the floor of parliament, it was passed that the program should be rolled out. And we even said, when it is rolled out, they shouldn't be given only 25, it should even be increased. But then, as I told you at the beginning, the resource envelope. Now when the planners, this is through the Ministry of Finance and other planners in the government, when they sat and they looked at the population we have of older persons, if they were to serve everybody, even if it was 25,000, they couldn't cover a big part. Now they had to discuss among themselves. What do we as politicians, we wanted it to be rolled out. We wanted everybody to receive that 25 and the age to remain 60. But then the planners now had a problem. So they came to us. When they came back to us as politicians, we also said, instead of throwing it out completely, let's find a way. But every year, we shall go reducing the age and maybe increasing the amount. If I can tell you, even if you read our papers, even in the last year's budget, we had passed a resolution on the floor of parliament that the money should be increased at least 30,000 and the age should be reduced to 75. That's what we recommended as politicians. But after our recommendation, then the budget goes to the implementers. And the implementers is the technocrats. So when they sat to discuss, they saw it was impossible. It was impossible. The program is good. We have given reports, we have oversight, we have success stories to tell. But then the resource envelope was small. That's when they came up with that idea of 80. Okay, right now we are serving those of 8 and above, but we are not happy with it. We still insist that the age should be reduced and this money should be added on. And we are not going to keep quiet. We shall keep trying. Of course, the president says when we get our oil, we had thought the oil would come out and the old persons would enjoy it. It has not come out. And when they increase the taxes, we are the very people again who complain. So it is a really problem. No one wants it to remain at that. We want that money to be increased and the age reduced. But where do we get the funds?
Now, Ministry of Gender, fingers have been pointed at you. Some of the older persons are not able to access some of these funds. And so many other claims that I also saw you didn't seem to be agreeing to some of them. You're going to be responding to that. But with the claims that they have raised, what steps is the ministry taking to address the gaps in the coverage, particularly for older persons and who are between the age of 60 to 79, who have been excluded from the SCG?
Okay, so thank you so much. To start with, social protection is indeed a right, and all our older persons should be able to be cushioned through social protection. Mildred, we need to live healthy. We are going to be sub-categorizing older persons, starting 100 plus. For your information, we have many older persons in Uganda who are above 100 years. And we are going to
When you say many, do you have a figure? Put a figure to it, because when you say many, we might assume...
We have estimates. We have estimates that will live here. So we're going to have 100 plus, 80 plus, and then we have 60 to 79.
Which is the biggest gap, right? The
Yeah,
biggest group.
The biggest,
Yeah,
yes,
it is
yes.
the biggest.
Now, in this biggest group, what we also see, the studies, we have done socioeconomic studies among older persons 60 to 79. Most of them, it's not because they are poor in terms of assets. They are poor in terms of liquidity. Most of the challenges we see are related to will writing. Another person has 30 acres, but he has no salt at home to put in food. How to turn these 30 acres into liquidity. Children also trying to say they want part of it, and that's where I have a challenge with violence against older persons. That we have seen many older persons with some land up country, with some coffee, but not tilled, not cared for, just because we need to do a lot of sensitization on how our older persons can productively use their assets.
Okay.
Honorable has put up the issue of older persons initially were not under the parish development model. The assumption was that majority of older persons are the owners of the actual factors of production, including land. That if you go up country and ask who owns land, it's owned by 60 years and above people. And so there have been this misnomer that maybe the older persons are rich, maybe the older persons don't need support, but we are here to demystify that. That they may be rich in terms of assets, in terms of land, but as Alana puts it, I may have 30 acres, but really I no longer have energy and all these ideas on how to productively use it. But as government comes into cushion, we are saying in terms of retirement planning, our older persons are expected to see how best sit with their family members. Let's avoid these challenges at home where children are focusing one side, the wife is focusing another side, and the 30 acres are remaining there without being properly utilized to care, to fend for the family. Honorable Wako has already spoke to the fact that government had the will and still has the will to lower the targeting age for SAGE from 80 up to 60. The resolution of Parliament, which was passed on 28th November 2018, was indeed to lower the age every year from 80 up to 60. COVID set in, and across the country, even in the region, I think some countries who were being supported by development partners, when development partners withdrew, unfortunately, they stopped the programs for older persons. It's only Uganda and a few other countries that remained resilient, and government took over the responsibility from donors, 100%, not even part of it. They took over, and the government is currently, or has been putting in 121 billion to roll out this program and to pay all older persons across the country. Aran has put it right that we currently have a funding gap of about 20 billion. And we've been in touch with Minister of Finance to ensure that this 20-point-something billion is brought back, because we are currently paying everyone, but come fourth quarter, a section of older persons may not get their resources. But we are in touch with Minister of Finance, and we are very positive that older persons will get their money. The beauty of it is that government has programmed these resources as more of an entitlement, to the extent that an older person whom we don't pay because Uganda Revenue Authority has not brought in enough tax, we actually capture it as an area, something that we can pay back as a debt. So I still want to insist that government has really prioritized this program, save for the limited resources that sometimes put us down and we don't meet our expectations as we should be.
And does the, sorry to cut you short, but does the government also get down to the rural areas? Because these are the people that are mostly the most vulnerable when it comes to the social protection.
Surprisingly, when it comes to social protection vulnerability, it's strange that even in urban areas, actually the urban poor among older persons are really struggling a lot. They are struggling in terms of options to nutrition. They are struggling in terms of peer support, in terms of accommodation, in terms of fresh food. And we normally say older persons need about 4 or 5 things. They need company, which is limited in urban areas. Most older persons, they come in town for treatment and they start crying that they want to go back in the countryside where they are able to get peer and social support. So they need company, they need exercise. Exercise in urban areas, you are on tiles, you are on stones, so even the simple exercise that you could think of, because maybe you don't have enough big compound or grass where this older person can do some walking, and wherever they are walking, they're even worried about their safety. So we need exercise, we need company, we need spiritual support, we need some investment, and I still want to insist on the issue of will writing. We have had older persons get unwell and children and start struggling, pulling ropes around the resources, and some of these older persons actually get into stress and depression because the children are fighting over their property. We have had children telling their parents that, oh, I'm waiting for him to pass on so that we sell the property. So we are calling upon our older persons to contact the legal aid organizations like ICE and others, to get us information on how we can make wills, to get us information on how we can turn our assets into liquidity, that as government comes into cushion, we also have something to push us on.
Okay. Yeah. Well, thank you so much, Prosper. And for you, the viewer that is just joining us right now, the conversation we are having is about social protection for older persons, looking at how important this is and also ensuring that they can live with dignity and security. And if you're just joining the conversation, the hashtag to follow is People's Pension. That is on X or Twitter. Feel free to leave your comment on what you think needs to be done to ensure that the older persons can be able to live with dignity and security. And now I want to turn to Alana, civil society, of course, with the recommendations. What do you think that the government, ministries and all the other different stakeholders need to do to ensure that some of these gaps of the older persons are actually addressed?
Yes, you know, he talks about older persons owning land, but the data is also clear that 48%, about half of older persons are living in poverty, in very desperate, hard conditions. Young people come here to hustle. I meet young people on the streets, the ones who come to you selling, I don't know, kasengeja or, you know, butunda. One of them told me, can you imagine, today my mother called me for, was it 10 or 20? And he's like, I made no money. And he was so close to tears. So what does he do? He doesn't pick calls. So older persons, they are a significant number. And I don't want us to yes, there is progress, but to not grasp how serious this situation is. And this is going to continue to happen because as urbanization grows, it often comes, the social structures that help people together, where, I don't know, in our culture, for example, it was the wife of the son that's supposed to take care of the father. Now you're here or you're elsewhere, you're separated in different countries. The person is by themselves. So I think it's very important that we begin to ensure that there are rights-aligned, universal social protection systems. This is very, very important. Because when it's rights aligned, you begin to think about different things. The participation of older persons, for example, he was, you know, no one speaks better than the people who are having their lived realities. And that means that even when it comes to issues of budget cuts, who participated in a decision to cut billions after you announced on national TV? And Ministry of Finance, I think the country needs your assistance to swiftly resolve this, because if an older person is there, they've known they're on the program, the budget is read, now they could not get the money, and then they're wondering. And organizations like us, we participate, we go to parliament, we present on budget and so forth. So I think it's extremely important I think it's a heated discussion here, that we have rights, that we have these rights-aligned systems. It means that when I'm cutting the national cake, just like in your homes, you make sure that children have food. You make sure the older persons have food. You're the grown-up, you can queer yourself. Maybe you'll have porridge today and sleep. You know? So I think we must look at all those things, curb the leakages. And social protection as a right requires us to look at the law as well. Like I said, you know, pension is enshrined in the law. But that leaves out the informal sector. And that's most of Ugandans today. And so I think we need to have that critical conversation. We've been sidestepping it, you know, we talk about, yes, preparing, planning, benefit. All of that is good, you people, but you can plan and life still happens. We know that. For me, it's a lived reality in a number of my own relatives' lives. So I think it's very important that we begin to really think about pushing for universal pension. And the social protection gains we have made, and we have made good ones as a country, enshrine them in the law. Take the effort to put them there in the law for future generations. So when their learners are now in government, or the younger generation, my children, they don't wake up and say, why are we doing these things again? That president was very wonderful, but I think let me change things. No, we need to have these gains safeguarded in law. And I want to thank the government, because I think that there's a lot of thinking. I'm very impressed when I hear the MP from Older Persons, the Ministry of Gender, and even Finance. We've talked a bit about harnessing natural resources for funding some of these things. There's a lot of thinking around this. We need swift action, particularly to avoid the crisis with sage that is coming any minute now. So for us, our Christmas gift that we want is to make sure we see these sage cuts reinstated immediately. Thank you, Alana. And John, you would like to add on to what she said?
I want to add on to what she has just said. And that is an issue I wanted to bring up as an older person. You see, this social protection was set up very beautifully, but without an enabling law. So as of now, those people who are in positions of power, let me give you an example. When SAGE came, the first casualty, when COVID came, 2019, the first casualty in the budget cuts was supposed to be SAGE. They had cut the total budget for SAGE. Now, we were just lucky that the political repercussions started sending shockwaves. So they said, that is dangerous ground, don't tamper. That is how SAGE survived. But otherwise it would have gone. Now it is threatened, like she said. We have arrears. Prosper has already referred to them. We have shortfalls. And one of the reasons is we cannot hold anybody accountable because there is no enabling law. So we are going to appeal to the commissioner because they are the ones who initiate the laws. The law on social protection. We desperately need one. Now there is the Older Persons Bill, for instance, the law protecting the rights of older persons. It has been held in abeyance for the last 3 years. It is still there. So as older persons, we actually don't have a law that protects us. Okay. Yeah. And part of it, I think, is the Constitution. Let me give you an example. I think it is Section 34, which says a parent or a guide is mandated to take care of the children. And then the Children's Act allows the children to sue the parents for neglect and things like that. Yeah. But how about the older persons? He has mentioned the older persons who are lonely, who are alone, whose children they've brought up very nicely, in very big positions of responsibility. So you also want them to be able to sue their children. Reciprocal law? To sue their children. Yes. Allow me bring the honorable. The children are supposed to take care of you as well. The honorable, John from the member of the Council of the Older Persons says that there is no law for protecting the older persons. But also, have there been any challenges for you as you're trying to push for the rights, social protection for the older persons?
Challenges like what?
Challenges as you're trying to lobby. Have you, as the representative for the person of the older persons, have you, effectively voiced you know, on the floor of Parliament, the issues that the older persons are facing, because John is clearly saying there is no law. Even Alana did highlight the same thing. And what has been the outcome?
Yeah, he has mentioned of the law. It is true the law is not there, but I know this issue of old persons hasn't taken many years. For example, this is my third year in Parliament, and these are some of the things we are trying to bring up, because we need a law on social protection. We need other laws to protect old persons, but everything cannot come in once. As I've told you, it is process by process. We started by first catering for these people, for them to get their money. Now they are getting the money. We want the age to be reduced. So all those things, we have them in the process.
Maybe the process is taking so long.
Well, that is how government things go. You can't think of something today and tomorrow you think it will be effected. Then another thing, they were worried but the budget was reduced. That one I think shouldn't worry you members. Usually that's what happens. But government will find a way of making sure they cover up. I think you always hear that supplementaries. At any moment they will bring in a supplementary, and we as members of Parliament we shall pass it, and part of that supplementary will be to cover up for this deficit.
Okay.
So for sure, the old person, this is a government program, the government is going to support it.
Okay.
That's what I know. They are supporting it, they will continue supporting it, and all members of Parliament are in favor, are in support of old person issues.
Okay, I'm afraid our time is fast spent, but I'm going to allow me bring you in
just a small one
as you wrap up with your closing remarks.
On that budget,
yes,
just a small one. You know, when this SEGOP, when the president said we could go ahead, the sum was 10 billion. When it arrived at the Ministry of Finance, they said, 5 billion. First year, 3 billion. Second
so it kept on depreciating.
Now next year, 1 billion. that sort of thing. Now how do we operate like that?
What would be your closing remarks, John?
Well, my closing remarks. Now, as older persons, definitely social protection is something we should embody. My appeal to government, right now government is allocating just about 1% of GDP to social protection, when the average for African countries is 3%. And globally, it is 12-point-something%. So we are well below the recommended allocation for social protection.
Okay.
We want to appeal to government. It is our right to have social protection. It is government's duty to provide social protection.
Okay.
Please add the percentage from GDP.
Okay.
We are all looking forward to oil, but oil is not the only panacea. Money can be found from somewhere else even before that.
Okay, thank you. Now, Prosper, to you, as you give us your closing remarks, are there any future plans to better the lives of the older persons?
Yes. We currently have a shortfall of 7 billion under SEGOP, Special Enterprise Grant for older persons. Instead of 10, we have 3. As the young man from Yumbe puts it. We are in touch with Ministry of Finance to ensure that the 7 billion shortfall and the 20.3 billion for SAGE are brought back. The Honorable mentioned the issue of the government challenges, that you put a tax fund social protection, parliamentarians reject the taxes because they think the citizens won't be able to afford the tax regime. So government sometimes is pushed between a hard place and a rock, but here to commit that we are looking for all the options to ensure that we safeguard the rights of older persons. The senior citizens of Uganda suffered during their youthful times. They sweated to make sure that we have a brilliant Uganda that we are enjoying, and we can't take them for granted.
Thank you.
Last shot is that let's be there for the conference tomorrow, but also,
I'll come to you.
As government puts in, let's the young people also put in, send something to your older persons up country their day will be a smiling day.
Thank you so much, Prosper. And finally, Alana, as Prosper has already shed light on the conference, maybe in your closing remarks, how important is it for the public to also participate and to ensure that the lives of the older persons are they're living with dignity?
Yes, to the public, what is your plan for social protection in your old age? If you don't have a plan, you are not sure. Some of you told me you hope you'll be dead by then. We have increasing life expectancy. Please come to the conference. You need to be part of these discussions. They are important. Discussions that are made today are going to affect you 40, 50 years from now. So it's important when you get the opportunity, and we're so pleased and lucky to have the government partner with us, to come to our people's conference, an open public conference, to talk about these issues. Please come and make your voices heard. There are many things they are grappling with: how to get the money, where best to get the money.
Yes.
You know, how do you train the law? What is the right? Come. As Supposed to say in the media, we have a manifesto called People's Pension that sets out clear demands. Some of the clear demands are, like we've said, having this enshrined in law. Social protection is a right to safeguard the gains that have been made already by this government and others, and to make more gains, but also to increase the funding envelope. And finally, on SAGE, my appeal is really one of humanity. We usually like to talk as lawyers, but from a humanitarian basis as well. People are going to lack salt and food and like basic needs if you do not bring a budget and do something to curb the funding shortfall that some official did somewhere, because when Parliament was passing this initially, there had been a real concerted effort to have it there. So it's very important that anyone already on the program right now, there are very few people above 80.
Thank you.
You make sure that you get this.
Thank you, Alana. And finally, Honorable, in a minute, what is your closing remarks as well as your pledge as Parliament? Yes.
Now, first of all, I'd like to reassure my brother here, the young man of Yube, because this one we have been together in the struggle for this thing called old person issues. I would like to reassure him that he should remember when we asked for this money, it was 2016 when the president gave us the 10 billion. This money was never released until you people, when you sent us to Parliament.
Okay.
It is when we went and faced those people face to face, and they released. Of course, the president had said they give us the 10 billion.
Okay.
But you know what happens with the planners. And I think,
as I conclude, it is why you people, you have sent us to Parliament. We are not there sleeping. We are not there seated. We are there to fight for the rights of old persons. And this is just, you have seen a few things which have gone through. And we have, and we have so many in the pipeline. You just give us a chance. We have just, it is a baby, we have just produced a baby. We want to leave this baby when he's walking. I know we have so many things we are planning for you old persons in the pipeline. And if you give us a chance to serve you, you are going to be happy in the next few years. Thank you so much for listening to me. Thank you so much, Honorable.
The conference is at the UMA Multipurpose Hall at Lugogo, so you can come. You're very welcome. We are looking forward to seeing you.
All right, a big, from 9:30? 8:30 a.m. All right.
Provided.
Thank you so much, and thank you so much, our viewer, for being a part of this conversation. A big thank you to ISA, a big thank you to the Ministry of Gender, a big thank you to the Parliament, as well as the member, the National Council for the Older Persons, for trying to fight and advocate for the rights of the older persons. Also, you, the viewer, or you, the public, equally have a role to play, because this is all a journey. This is a transition. We are transitioning into that stage where the older persons are. I'm Mildred Pedun. Have yourselves a good morning.